Hello, everyone. Thank you for being here today. My name is Crystal Ramirez. I am a master's level counselor, a consultant with the Wyoming Office of the Guardian ad litem, and the full-time youth coordinator for the National Association of Counsel for Children. I am also a person with lived experience in California's child welfare system, where I aged out after 11 years in foster care. I'm very glad to be here today, so thanks for having me. Before we get started with the panel of folks who will be speaking about the implementation of Family First, I wanted to pause and ground this conversation in the importance of youth and family voice. You may have heard the term youth engagement, but what does authentic youth engagement actually mean? And why is it so important to include the voices of people with lived experience when thinking about Family First? And then we must also consider how to include them and when and where. As you hear today, the Family First Act is one of the most significant pieces of federal child welfare legislation in a few decades. Its goal is, well, to put families first, to prevent unnecessary separation of families, and when that is necessary, to ensure young people have the chance to grow up in families rather than institutional settings. It will be a big change, and change is not always easy, but it can be made easier when guided by the expertise of people with lived experience. Which leads us to the why. Why is it so important to include the voices of people with lived experience? People who have navigated the foster care system know better than anyone what is needed for themselves, for their family, and what system changes are needed to be put in place. They may be able to see something you can't see if you haven't personally navigated the system. Youth and families are experts in their own right, and until we fully and authentically engage them, we won't get to the results we really want, to keep children and families together safely where they belong. So, while we may ask the question why, we can also ask why not? Why not engage people who know the ins and outs because they have lived and breathed daily what it is like going through the foster care system? Why not engage people whose lives are being affected or have been affected? Engaging people with lived experience means turning every corner and getting rid of any blind spots folks who have not been affected by the system may have. That is why we must engage, always and authentically. How is likely the next question to be asked? Well, there are a few levels to youth engagement that you may want to consider. First, there is systems level involvement. Here, you can engage youth by making sure you are providing spaces for folks with lived experience to hold leadership and decision-making positions. This can look like having a youth advisory council or youth advisory board. This can look like working with people with lived experience to develop training and also consult them on different projects or policy development. As Family First is implemented, this can look like having focus groups with youth and family voice on what kind of resources are needed to really support families. When organizations or systems take time to pause and let people with lived experience guide the way, or when they are open to sharing power, it has and continues to make such a big difference. It's also something we must do intentionally and thoughtfully. Having youth be invited to one planning meeting or just having a seat at the table for the sake of having a seat isn't enough. We must continue to make space, listen, and shift when needed. Second on our levels of involvement is peer level involvement. This can look like having peer parent advocates that are folks who have journeyed through the system and can work with parents who are currently navigating it. Or it can look like having young people who have aged out of the foster care system working with young people who are still in the foster care system. This is personally something I really enjoy both doing and have also found that it's really impactful. It can be so game-changing to have someone on your team who really understands your experience. For the last several months, as I have been working to develop a peer advocate program with the Wyoming Office of the Guardian at LIDEM, I have had the pleasure of serving as a peer advocate myself and have heard of the difference that it can make for youth. And while on one side, I might be a fun person for them to talk to, it seems to go deeper than that. Youth have expressed that they feel heard and have been able to find an adult that they can confide in and seek for guidance. They get to ask questions when they don't understand something and don't know how to ask. I also have, at different points in time, been able to see something that other folks can't see, whether it's resources that are needed or a different approach that can be taken, or advocating for a youth's wants that others may not see as important. As a young person, I have been able to advocate for normalcy for foster youth that adults can sometimes forget about, and normalcy is important. And those are just a few of the ways that peer level involvement can be beneficial. The third level of engagement is case level involvement. And this is a level where every single youth or parent who is involved in the child welfare system should absolutely be engaged. Here, regardless of which capacity you are working with youth and families, you should make sure that they are continuously informed and ask what they think is best, what they would like to see happen, and ask what kind of support they need. A youth and family's case plan should never be planned for them, but rather with them. And under Family First, authentic engagement at a case level involvement might mean making sure that a youth's voice is fully heard each time the court is considering a placement for them, especially if that is an out-of-home placement. With some of the whys being covered and a few of the hows, the final question might be, so when do we engage youth and families? The simple answer is always. Every step of the way, whether it's policy related or case level involvement, youth and families who are or have been involved in the child welfare system should be engaged. There shouldn't be any step in their case plan where they are not thoughtfully engaged and consulted on the happenings in their life. So often, youth and families feel like and don't really have a say in what happens to them. It's important to provide space for voice and choice every step of the way at every opportunity. So, as you listen to this morning's panel, I ask you to keep in mind, while you think of the implementation of Family First, make sure you are including voices with lived experience. If you take a look around the room, whether it's virtual or an in-person meeting or planning session, are there youth there who have been affected by the child welfare system? Are there parents? What about kinship providers? Who's missing, and how can we center ourselves authentically and intentionally around youth and family voice? Thank you. And now I'll go ahead and turn it over to John Steinmetz with CDHS for a Colorado-specific Family First panel.
Thank you and good morning. Thank you especially for setting the table so well for a discussion about putting family first. I'm going to have our panel introduce themselves in just a minute, but before we do, just wanted to thank those who had already submitted questions yesterday through the survey. We've used that to update some of the materials we'll be presenting today. And we are going to seek to answer as many questions as possible. Whatever questions we're not able to address today, we will seek to address through the Family First Digest and other materials and support that we provide. So please feel free to enter questions in the Q&A and we'll seek to get to as many as possible. I'm John Steinmetz from the Colorado Department of Human Services, Division of Child Welfare with the Learning and Development Team. And now, Andrew, would you like to introduce yourself?
Sure. Hi, good morning, everyone. I am Andrew Gabor. I'm also with the Colorado Department of Human Services, Office of Behavioral Health. I am the Family First and Youth Services Liaison for the office.
And Ashley?
Hello, I'm Ashley Case with the Office of the Child's Representative. I'm a staff attorney and legislative liaison there and have been working on Families First for the past several years as the co-chair to the implementation team.
And Gail?
Good morning. My name is Gail Engel. I am a grandparent raising my grandchild. I am also a member of the Family First Prevention Service Act implementation team. I also am a Colorado representative for Kinship families at Generations United, representing kin within the federal government.
Thank you. And Angelina? We lose Angelina?
Nope, I'm here. Sorry. Just took me a minute to find the unmute button. All these different platforms, I can't keep it straight. Good morning, everyone. My name is Angelina Callis. I am the Family First Project Manager for CDHS. Really excited to be here. And I just want to point out it's National Denim Day for Sexual Violence Awareness. So I'm wearing my denim jacket in support. I know everyone else dressed up, so I just felt like I needed to say that.
Thank you. And Yumiko?
Good morning, everyone. Yumiko Doherty with CDHS. I am the Director of Strategic Planning and Implementation for Community Partnerships. And over the last year or so, I've been serving as Chief Strategist for Family First for the department.
Thank you. And Gretchen?
Morning, everyone. Gretchen Russo. I'm the Judicial and Legislative Administrator for the Office of Children, Youth, and Families at the department. And I have been on the implementation team with a number of these folks for a while now, and the co-chair of the Juvenile Justice Work Group. Thanks, John.
Thank you. Let's see if I can get this started. Almost there. Sorry, fighting with my technology. There we go. No. Okay, is the screen sharing yet? Okay.
I can see it, John.
Okay, thank you. Then Yumiko, I think, is leading off.
Actually, I think Ashley is gonna
Okay.
start us off with a quick refresher of Family First before we jump into the weeds here.
Thank you so much.
That's right. Many of you in the questions that you sent in, it was clear that while I think many watching have some familiarity with Families First, there are still quite a few people attending who haven't heard much about it. So we'll start out with just a small refresher on Families First, and then we're going to dive into the details as we go. So just to remind everybody, Families First Prevention Services Act was signed into law in 2018, if we can remember back that far. A lot has happened in our lives since then. And it came down as part of the Bipartisan Budget Act, which seems like a little bit of a strange place to be making incredibly huge child welfare reforms. I know many people on the ground at the time thought this sort of came out of left field. But in reality, this bill had been worked on and had come close to passing in 2016. And it appears that there were folks working behind the scenes over a few years, and the timing just happened to be right that in 2018, they were able to slide that into the Budget Act and get that passed. So in 2018, it kind of came as a surprise, but had been worked on for many, many years by a lot of people who cared a lot about child welfare. What it does is it reforms child welfare financing. So how we pay for child welfare, which, you know, drives a lot of policy and change in the way it plays out on the ground. So as you heard from Crystal, this is a really major modernization and overhaul to child welfare. It was the first big overhaul that had been passed in over 3 decades. And it really provides an opportunity to transform child welfare. The intent was not to make a few little changes or make a few little improvements. The idea was to turn child welfare on its head. That's what it was designed for. That was the purpose. It was to really change the focus, change how we think about it, and change how we do it. The bill provided sort of a runway of opportunity to implement this bill in the state, but the kind of drop-in date was October 1st of 2021. So while states can and have opted into Families First earlier than that, all states have to be opted in by October 1st of 2021, which is now seemed quite far away when we first started having these conversations, and now is just around the corner. Again, this is not a program that you can choose to do or not. If you as a state want to receive Title IV-E funding, which is the major funding source for most of our child welfare, then this is what you have to do. You have to implement Families First, which in Colorado really aligns with some of our ideals anyway. We in Colorado were opted into some prevention work prior to this opportunity. And so I think in Colorado, we really embrace the idea of this change. Families First kind of has a few different sections to it. So the first one is it talks a lot about prevention. The whole idea is that we need to start keeping families together, keeping them healthy and strong. So this is a quote here from Jerry Milner. He at the time was the commissioner at the Children's Bureau when this change was adopted. And he says, "We must re-envision child welfare in the United States as a system that strengthens families and breaks harmful cycles of trauma and family disruption, rather than waiting until children are hurt to respond." And it's really a powerful statement. I mean, he is describing this fundamental shift in philosophy and practice to not being reactive to situations happening in families, but being proactive and really trying to help families where they're at and have that prevention mind frame and try to keep people from entering the system as much as possible. The practice is also shifting that when they are in the system, we're going to try to minimize the harm and minimize the damage in ways that we haven't thought about before. And this philosophy is really based on good data that we know now, that removal and separation from family causes harm for many, many children, that children who experience multiple placements are exposed to additional risk factors and diminished outcomes. And so Families First really tries to get in front of some of those issues. So prevention is kind of the keystone of Families First Prevention Services Act, as you can imagine, given the title. Within the act, then, there are also parts that talk about placements. It talks about how we'll deal with older youth, and it really focuses on kin and kinship supports as well. So we're going to get into those pieces specifically, but that's just the broad overview and the idea of what we're doing here.
Thank you.
Great, thank you, Ashley. And so Ashley really touched on a lot of these pieces, but if we take a step back and look at the overall Colorado vision for child welfare, which we'll go through here in a minute, you'll see that Family First really aligns with this, and as a way can be seen as a catalyst and pushing us forward, realigning our financing streams to really make sure we are living into this vision. So as Ashley mentioned, first and foremost, the vision is to prevent maltreatment, child maltreatment whenever possible. When that's not possible, we want to try to keep families together safely with services and supports whenever possible. When that's not possible, if children and youth cannot remain safely at home, we want to make sure they're in the most family-like setting possible, preferably with kin. And if a child or youth needs a higher level of treatment, such that it cannot be provided in a family-like setting, we want to ensure that if they are in a congregate type placement, that those placements are high quality, short-term, and treatment focused. And so if you go to the next slide, John, really our presentation is going to really mirror some of these main areas of both Family First, but also the broader Colorado vision. So we'll start with prevention and then work our way through the entire continuum, from kinship supports all the way through QRTPs, which represents kind of those higher levels of residential care. And then we'll finish off with talking a little bit about the juvenile justice population, which is absolutely included and incorporated into Family First, but also has some unique considerations as well. So we'll start off with prevention services. And just a little bit more information about what's actually in Family First and what we know to date. So Family First creates the opportunity to access federal 4E funding for prevention services. And this is brand new. This is the first time in history that states have access to 4E for the purpose of prevention. Historically, states accessed 4E for out-of-home placement. And so this, again, is realigning federal funding streams further upstream with a more focus on prevention. We get this question a lot of what does prevention mean in the context of Family First? That's a term that I think can mean different things depending on who you're talking about. In the context of Family First, prevention means we're preventing the need for out-of-home care. So the aim of prevention services is to keep families together and safely at home. In order to access federal funding for these services, they need to be evidence-based and trauma-informed, and I'll talk in just a minute about what we mean by evidence-based. That's another term that can mean different things to different people in different contexts. Notably, I think Family First realizes that in the child welfare context, it's not just children and youth that are in need of services and support, but rather the entire family unit. So services, eligible services, can be provided not only to children and youth, but also to parents and or kin. So again, not just targeting the individuals in that family, but also the functioning of the family unit. And then finally, prevention services, the funding for prevention services is not dependent on the family's income. So truly, Family First is creating a new entitlement. So anyone who is eligible for these services, and we'll talk about eligibility, can receive this reimbursement for these services. Next slide, John. In terms of the services that are eligible, and when I say eligible, again, that just means that these are the services that are eligible for 4E reimbursement at 50%. Those services fall into three main categories. They need to be either related to mental health or substance abuse prevention and treatment, or they can target in-home parenting skill support. States can also access this Title 4E funding with Kinship Navigator services and supports, which we'll talk about in the next section. And then there's also this, the law calls out this population of children who may be placed with a parent who is residing in a licensed residential substance abuse treatment setting. Getting at the topic of evidence-based, which I think has been widely talked about related to Family First. Family First really created their own definition of evidence-based. We know there are various clearinghouses and things that already exist, but Family First went ahead and created their own Title 4E Prevention Services Clearinghouse, along with various evidence standards. So the clearinghouse is an entity that's really charged with reviewing and rating eligible services for 4E funding. And they have three different rating levels: promising, supported, and well supported. At the end of the slideshow, we do provide a link to the Federal Clearinghouse because that list of services is ever evolving. It started off with a rather small list and it has been growing steadily over time. So that's a good resource in general to understand some of the research and the level of evidence behind various prevention-related services. Next slide, John. So, oh, and candidacy. So in terms of who is eligible to receive these services, so we said already that it's not just children and youth, but also parents and caregivers. States had the opportunity to further define who were candidates to receive these services. And Colorado took the track from the very, very beginning that we wanted to be as bold and broad as possible in defining our candidacy and what that meant. So in some states, they've taken a more targeted approach where they're really targeting families that have already touched the child welfare system, but where we can really help keep families together and providing in-home services. Colorado wanted to go even broader by saying, truly the purpose of prevention is to ensure that families don't even have to come into contact with the child welfare system to begin with. And so our definition, if you read the entire thing, which we are linking to in the slides again, is really about identifying various risk factors that could put a child or youth at serious risk of eventually entering or re-entering foster care. So we don't call out specific pathways to candidacy or prevention services, but rather call out various risk factors. And so the longer term vision, again, is that we're reaching families further and further upstream so that in order to access prevention services, they do not need to come in contact with the child welfare system. Okay, next slide, John. And these are some points I really want to emphasize, and I think they are somewhat responsive to some of the questions and comments we received through the survey. I think while Family First presents a great opportunity, again, this is opening up a whole new funding stream for these services. It's a wonderful opportunity, but also don't want to overstate what the clearinghouse represents and what Family First eligible services represent. So the clearinghouse, again, is a list of services that are eligible for 4E reimbursement. It's a list of services that have been well researched and invested in over time. It does not by any means represent a silver bullet. It does not by any means represent the full array of services that youth and families will benefit from. And so we need to think about Family First eligible services as just one piece of the puzzle for strengthening families and keeping them whole. I want to remind everyone on the call that counties will continue to be able to use their child welfare block, their core dollars, their CMPs, county-only funding to continue funding and providing that comprehensive array of services to be truly responsive to the needs of children and families. And Family First is now one additional piece and opportunity that we can leverage in building out that services array. And over time, I think the opportunity is to continue expanding that array of services, to continue identifying where are the gaps in our services array and building evidence over time to ensure that we are delivering the most impactful evidence-based services possible. And so to emphasize, there is no requirement for counties to have Family First eligible services available in their county. The goal is really, again, to leverage this as a new opportunity, as a new funding stream to ensure that all areas of the state have high quality responsive services for families. I think the other opportunity that Family First has brought is that it's opened up the conversation about prevention services, really understanding where are these available in the state, where are they not, what does a comprehensive continuum of services look like, how can we leverage this new funding stream to continue building that array. And so it's really been a great, I think, conversation starter that's brought a lot of players to the table to talk about prevention and what that looks like in Colorado. Next slide, John. In terms of some of the specific things we're working on at the state level, in order to access federal 4E funding for prevention services, each state has to have a federally approved prevention services plan. So Colorado has submitted a draft prevention services plan, and we are currently in negotiations with feds to finalize that plan. We will link to a copy of that plan, which is available on the CO for Kids website, so you can take a look at that. And in that plan, for example, is our definition of candidacy and a list of the services that Colorado is proposing to claim 4E reimbursement. We are also ensuring at the state level that we have all of the various infrastructure needed in terms of monitoring, data tracking, in order to track the data needed to actually claim for 4E reimbursement. We've also done quite a bit of work. There's a services continuum work group under the Family First implementation team that did quite a bit of work trying to map out across the state where various prevention services are currently available by county. And so you're seeing a visual of that on the slide here. Again, this is an interactive map that we will link you to so you can look at your specific county. This map is representing just those clearinghouse services. So again, this isn't a full picture of prevention. And I also want to acknowledge that this just means the service is available. It doesn't mean that there's sufficient capacity or that all families can access that service when needed. We are having lots of strategic conversations around what is a statewide or regionally focused expansion strategy for prevention services, and how can we strategically invest the funds that we draw down in 4E, as well as Family First transition funds that the state has received, in order to really set a strong foundation of prevention across the state. And finally, I just want to touch on a few things that we want to leave you with in terms of thinking about what can you be doing around prevention services. So next slide, John. Some of these things that we're doing at the state level, I think we really need to start mirroring that at the local level. So thinking about what does that array of services really look like at the county or jurisdiction level? Where are the gaps? And where are the opportunities to expand? We have a list here. I think it's most important to identify what are the existing forums that bring together all the critical players to have these conversations about prevention services. And so there's a list here, for example, your local best practice court team, collaborative management programs is always a good one, etc. Next slide, John. And so using that state map that I talked about as a starting point to talk about what services are available in your jurisdiction, not just those that are Family First eligible, but also that complete that full array of services. We will be engaging in the next month in some regional conversations to really understand what the different service gaps are at the regional level and what are the needs for expansion of services. So engaging with us in those conversations. Identifying any service adaptations that may be needed for unique populations in your community. So for example, to ensure cultural responsiveness or to improve access in rural areas. So thinking through those potential adaptations so that you can advocate for those needs at the state level. And then finally, consider applying for Family First transition funds. We're going to be releasing a second round of funding opportunity coming up in June that anyone can apply for, including counties. And so thinking about what are your needs, what are your gaps, what are your innovative ideas to expand prevention, and potentially submitting an application for funding. So with that, I'm going to turn it over back to Ashley to talk about the continuum of care in Colorado.
And actually, quickly before we talk about that, Yumiko, when it comes to prevention services, I know one of the questions we got was from our judicial partners. So judicial officers wondering, what's my role in prevention? You know, we think of prevention as something that happens prior to court or outside of court, which is hopefully going to be very true. And there may be less families coming to the court system. But I think judicial officers also have an important role in that prevention that sometimes can be a little harder to see. And so I just wanted to talk about that since we had a question on that. And, you know, I think there's a variety of ways in which this plays out. Obviously, in the cases that are in front of you, like the dependency neglect cases, you know, we have to think about prevention as kind of a whole circle. So obviously that family didn't get prevented from entering the system that time, but as that case progresses, there are many opportunities for prevention within the case, because prevention means preventing reentry. So really being cognizant of when that youth returns home or goes to kin and what services need to be infused to ensure that reentry isn't happening, because that's part of the prevention cycle. You know, prevention can mean making sure we don't have failed adoptions, or that our youth that are transitioning out have enough services that they don't end up later becoming a parent in the program and that kind of thing. So when we think about prevention, I just encourage all of us to think about how that also is a continuum or maybe a circle, and there are many opportunities for prevention within the cycle of a case and that kind of thing. But I also want to encourage our judicial partners to think holistically about prevention. You know, judicial officers come in contact with a lot of families in a lot of different areas. So, you know, you may come in contact with a family in, let's say, a truancy action, and there could be really good opportunity there for prevention services that might help prevent that family from needing further entry into the justice system. The same is true for our juvenile delinquency population, and Gretchen will talk about that later in the program. But, you know, how you can think of other case types and prevention in those case types to kind of help families not end up in the system is another thing I think judges are uniquely situated to do. And I didn't know if anybody else had anything they wanted to add to that, but just wanted to bring that to the conversation because I think a lot of times people are lost in the court system as to their role in prevention. All right, well, if y'all want to add into that, you can, but I'm going to talk a little bit about the continuum of care. So this is just kind of a nice visual to think about the continuum of care when it comes to children, youth, and families. So obviously, if you're starting on the left in the red box, you know, being at home is the primary focus, and that is going to be where we live. And as you progress to the right, kind of more intensive continuum of care needs where unfortunately youth needs to be out of the home. So this is what our continuum of care is going to look like in Colorado. So let's talk about this a little bit more in depth. You can go to the next slide, John. For family first, so when we say family first aligned placement options, again, that means what can we pull down this federal funding for? So what is eligible for 4E funding? So number one, first and foremost, is keeping kids at home with supports, really infusing supports into the home in order to keep a youth there. This is our number one option. This is our number one goal. It's the whole purpose of Families First. And I think this really ties into some of the conversations we had yesterday about this is how we help reduce our demand. We spend a lot of time thinking about the placement continuum in terms of what supply do we have? We don't have enough supply. Families First is very much about reducing the demand, and that's what we're talking about here. If for some reason that's not an available option or not appropriate, then our next step is always to be thinking about KEN. So here we mentioned certified KEN because again, that is where you can pull down that 4E funding, but it's also important to know that non-certified KEN play a very important role in this placement continuum. And a youth can be placed with KEN and also infused with supports in order to keep them in that home. So one of the, I think, wonderful things about Families First is that they think about prevention not just as the parents and the child, but as the family. So you can also think about infusing some of those supports into a kinship situation in order to keep a youth in that kind of setting, rather than having to go up the chain of the continuum. If neither of those are available, then and only then do we start thinking about a foster home. And family foster homes are supported by 4E funding in Families First. There's been a few changes to the rules in foster homes based on county feedback and some of the needs. So many of you may be aware that we moved the capacity on family foster homes from 4 youth or children to 6. So we increased our capacity that way based on feedback and what we were hearing. If you cannot be maintained in a family foster home, then there is a very targeted treatment option. We call it a QRTP. That stands for Qualified Residential Treatment Program. We'll get into the specifics of that later too, because that's quite a robust part of the federal act. But these are those treatment programs dealing with really acute needs for youth. Currently, you know, this is often done in an RCCF level of care. Our current RCCFs can work with their CDHS licensing specialist to become and make the transition to QRTP. We currently have about 20 facilities that are in process of having an application and looking at making that switch. So there are things they're going to have to do differently in order to do that. And a lot of our RCCFs are well positioned to be able to make that transition. What you do not see on this list is group homes and group centers. And that is intentional. So when it comes to Families First, the idea is that Children need to be in a family-like setting. We know that's where they thrive. If they have needs that are higher than that, they need to be in a trauma-informed, very targeted and focused treatment program. But the idea of housing kids in congregate care is going to be something of the past. There are, as with anything in child welfare, a few exceptions to the rule, and that's these carve-out populations that are listed here. These were enumerated in the Federal Act. These are the only ones that were enumerated in the Federal Act. And so there's sort of three areas where we can think about meeting the needs of these populations in a little different way and still pull down the 4E funding. So that's programs for youth at risk or survivors of human trafficking, and that is sex trafficking. They did not include labor trafficking at this time. The prenatal, postpartum, or parenting youth. So we often refer to this as pregnant or parenting teens. And this can be both anybody who's parenting, not necessarily just the youth who is pregnant. And then we also have our youth who are transitioning and doing independent living. So this would be, where a youth is in an independent living situation in their own housing or something of that nature, who need a little bit of extra support. So these are some of the carve-out populations that our groups are working on. And I think we're going to dive a little bit into the Ken part of the story here.
Thank you, Ashley. And I'm going to ask Gail to speak to us a bit about what the state of Colorado is doing around kinship support.
Yeah, so what we know is that Colorado defines a relative of a child, a person ascribed by the family as having a family-like relationship, a person who has a prior significant relation to a child. These relations take into account cultural values, continuity of sufficient relationship with the child, a grandparent, an aunt, an uncle, a family friend, or even a school teacher is what we call a kinship care provider, someone who has a relationship with the child. ICWA, the Indian Child Welfare Act, also has their own definition of kin. So we know that there can be some different definitions of kinship. So here in Colorado, we know that there are over 24,000 children who are in non-relative foster family homes, compared to 13,000 children who are in formal care systems being raised by kin, which is certified kinship foster care, along with 23,000 children who are being raised where the parent is not in the home with the kin. So 23,000 children are being raised by kin where the parent is not present. 115,000 children in Colorado are living in homes where relatives are the head of household. What is also important to recognize that for every child in the child welfare system, there are 19 more children outside of the system being raised by informal kinship care, providing prevention of children re-entering the child welfare system. We know that due to the opioid crisis, the mental health problems, children may not always be able to live safely with their parents. And diversion of child to the child welfare system does not always mean a way back to the parent. Making team decisions, including family, is crucial to determining the placement of children. When removing a child is necessary, placing children in kinship care is the least restrictive, and the child's life provides a safe and stable environment where they are already familiar with the least restrictive environment. Removing a child from their home is traumatic for the children and the family. Placing children temporarily with kin allows the parent to improve the situation and reunify them can happen. We know children do better when placed with kin with similar family lineage, cultural backgrounds, and established relationship, whether temporary or permanent. Placing children with kin provide a safe and stable home and with a safe, trusted adult. This picture also includes a kinship family that is in Colorado. Children should grow up in the least restricted environment whenever possible. We know children do better when placed with family. In Colorado, our goal is to reunify children when possible and to have better outcomes for youth. However, kinship families don't always receive the same financial and reimbursement as foster care providers with similar circumstances. The Kinship Foster Task Force has been established to make recommendations and changes to statutes, to rule, and to policy to reduce the barriers to kinship care providers to be a licensed certified kinship care provider, and establishing practices that better support kinship care, both certified and non-certified. The goal is to promote the change in philosophy that will better support kinship care and to address the place to assure the placement is made with the best interest of the child in mind and prevent the re-entry of children into the child welfare system. A Kinship Navigator program is being developed and evaluated in counties across Colorado, collecting data to establish a rating of at least promising practice in the National Clearinghouse. Establishing a Navigator program support kinship families by helping kin build a network of support and utilizing natural supports, existing public, private, and programs and services to meet the needs of kin care providers, such as respite and other needed supports to raise these children. By utilizing existing connections with kin care provider in our community and focusing on the goal of reunification, a whole family approach, and preventing further child welfare involvement. We should be working alongside of our parents whenever possible. When necessary, kin is the best practice for children and provide the highest placement and stability for the children. The goal is to prevent further trauma, re-entry to the system, and possible involvement with the juvenile justice system. It is important for youth to maintain familiar relationships and cultural connection. Focusing on the philosophy behind Family First, education of staff such as GALs, attorneys, judicial systems, and everyone involved with the family and children. Ongoing support and full family approach of children placed in kinship care is needed and will determine the best outcomes for children on into adulthood. Establishing a Kinship Navigator program will help kinship families navigate the mirage of challenges that they will face when taking on the responsibility of these children. Our focus should be on how we provide supports through either our community or funding of programs such as CCAP, TANF, adoption programs, RGAP, and other services so families can focus on raising resilient children. So I just want to add the story of my family is my daughter has mental health issues. She was able to place her child with me, and I've had my grandson since he was born. He is now 14 years old. But because of our relationship, because of our supports, he now has a very good relationship with his mother. She is now able to raise her daughter, and she continues to be part of our home and our family.
Thank you, Gail, for sharing on this. And now I'll hand off to Andrew.
Hi, again, good morning, everyone, and thank you, Gail, for that. So I'm going to be talking about qualified residential treatment programs and how to get into them. So what happens when those preventive services, the community-based services that Gail and Ashley and Yumiko have discussed earlier, what happens when those are not enough to meet the behavioral health needs of the child or youth? What options do we have according to the Family First Act? So first of all, we're going to be talking a little bit about acronyms. I'll try to avoid them, but you'll see a QRTP, which is a Qualified Residential Treatment Program. And as we said earlier, a lot of our current residential providers will be pivoting over to be a QRTP, a Qualified Residential Treatment Program. We're still navigating that, and I'll talk about that in just a minute, but these new designated facilities are outlined in Family First, and they really do focus on treatment of short and long-term clinical goals. And they will be incorporating families much more than historical precedents if the family is available and willing. Okay, these facilities also have to have 24/7 access to nursing and clinical staff. So that is a new requirement as well. And then federally, there are some limits on the length of stay of how long a child or youth can stay in these types of facilities. Without getting into the details, there's kind of different release valves for that length of stay. And then each agency has to have a trauma-informed treatment model. That model is reviewed and approved by the Office of Behavioral Health and then audited to by the Division of Child Welfare. And then each agency has to be licensed by Colorado, which is pretty typical, and then also accredited nationally. And that is a new requirement for these facilities. And then foundationally, it's really designed to be used when the child or youth and their family, when their behavioral health needs cannot be met in any other lower level of care. So the intent is that it will be for behavioral health interventions. So in a nutshell, that's what a qualified residential treatment program is. And then how do you get into one? And that's a big part of Family First, that they require an independent assessment to take place. So these assessors are licensed behavioral health professionals. So like your licensed professional counselor, licensed clinical social worker, and so on. And they also are going to have advanced training. So we're working with a different organization to help design that training and make sure that these professionals know about Family First, they know about child welfare, they know about juvenile justice and juvenile delinquency, and all these other different kind of specialty areas so that they have the full understanding of the landscape that these children, youth, and families are currently in. Okay. So these independent assessments can only be triggered by a county child welfare agency or the Division of Youth Services. And that happens either prior to services beginning in a QRTP or the day of admission that needs to happen. So it's a very quick turnaround. The state is designing specific flow charts and checklists and procedures to help counties and the Division of Youth Services to navigate this process. It's a very quick timeline for the actual assessment to take place. I say it's 10 business days, but you can also think of 14 calendar days as well. And so there's a lot that needs to take place for all that to happen. These assessors themselves are all contracted with organizations called administrative service organizations. They are directly contracted with the Office of Behavioral Health. And me and my team, we will oversee these administrative service organizations, make sure they're doing their job. Their job is to manage the local workforce to make sure that you all have access to these assessors, and that every corner of the state, every community in the state has access to these independent assessors, and that we meet our federal and state timelines. And then also they review the timelines, make sure that that's happening on their end, and then also quality assurance. That they're making sure that their workforce, the people they're contracting with, are doing really good jobs. Okay, this is not an easy choice to make. This is not something to take lightly. And so we need to make sure that there is robust quality assurance happening at the same time. And these assessors are financially and clinically independent from any decision and from this child or youth. And they have to sign an affidavit that for every single assessment that they complete, expressing that they are indeed independent. And then They are completing a full psychosocial assessment. It is a robust assessment for this child or youth and their families. Part of that is they will be meeting with the child or youth face to face once the emergency order from the governor is released, and then they will be reviewing any documents that are provided by them. They will be speaking with a variety of professionals. I presume most of the people on this call will at one point be contacted by them. That would include like guardians ad litem, families, kin, as Gail had mentioned, schools, any kind of documentation, current providers, previous providers, things like that, to get a really the best picture they can get, previous assessments that were done, all that good stuff. Next slide, John. So these assessors have to specify why the needs of the child or youth cannot be met in the family-like setting that we've been talking about, or a foster family home. So if they're going to be justifying a residential facility, they have to essentially express why the lower levels of care are not appropriate. Okay? So it's not just justifying why a residential facility is appropriate, it's why lower levels of care are not appropriate. All right, and that's a pretty big shift. Another thing is that for these independent assessors, the lack of availability of a lower level of care is not justification to put them in residential. Okay, that is a federal requirement, and so that's why there's so much focus on preventative services, because we want to make sure that you at the local level have access to those local services, to make sure that the continuum of care is robust enough where that lack of availability is not really even a concern, that there is availability in your community. And we're working on that. It will be an iterative process for sure. So then once the assessment is complete, the independent assessor will be filling out and completing an assessment summary. That summary is really the high level clinical recommendations, level of care recommendations, the time they spent in residential before, the history of services, and you can kind of read the slides. We are using a tool called the Child and Adolescent Needs and Strengths tool that will help guide discussions around coming up with consensus with everyone involved and identifying the key needs and strengths of this child, youth, and their family, and then identifying short and long-term goals. That assessment summary will be given back to whoever made the initial referral. So if it's the county, it will be given back to the county, and the county will then include that on their report to the courts. Okay. Another thing is for the independent assessment, I got one more bullet there, John, sorry. There is no appeal to the independent assessment. It is a recommendation. The independent assessor is not making a decision. They are making a recommendation based off of their robust clinical assessment, the discussions they had in the family and permanency meeting, and the tools that are at their disposal. And they are making a recommendation based off their clinical expertise. It is up to the courts to make that decision for county kids, for youth in the Division of Youth Services. That will be the Administrative Review Division, which I think Gretchen will get to, maybe. Anyway, there's a lot to it. All right, next slide. Thank you. All right, so what do we have right now? I'm excited to say that Weld and Douglas counties have started the assessment process. They are accepting referrals. I think Weld either today or tomorrow will be accepting referrals for this process. We have approved licensing rules for these qualified residential treatment programs. And then we are also providing technical assistance, and we're going to be ramping that up even more to see if these current providers are going to be pivoting over to become a QRTP or even a higher level of care, which is called a psychiatric residential treatment facility. These are not widely used in Colorado. We do have a small number of them, but the PRTFs, as the acronym is a medical-based residential, but it's still focused on behavioral health, but it's a medical model, put it that way. And so there's a couple different options to providers. And then we're going to be providing robust and ongoing training to judges and other people regarding this court process. And Ashley has spearheaded the development of a bench card. And so I think that's out. So yes, Ashley's shaking her head. All right. So we need to make sure that all communities have access to trained assessors by October 1st. We also need to make sure that we have a adequate bed capacity, which Ashley talked about a little earlier. I think it was Ashley. Yeah, it was, by October 1st. And then really ensuring that all of you have a full understanding of your role with this assessment process and this change in residential and the why. And I think Gail did a really good job on the why, that we're trying to keep kids and youth in the communities. And if they need treatment, it is shorter, it is more robust, and that it's targeted, and for them to go back to the community as quickly as possible. And also reviewing the bench card and other trainings that will be available in the near to middle future, I should say. Next slide. So one of the things that you can do is work with your partner agencies in your county that you've already been working with and outreach really your county directors and see about bringing the administrative service organizations to the table to have these discussions as a group. And all the county directors do have the contact information for these administrative service organizations already. It's part of the toolkit that we send out every Monday to all the counties. And to have those local conversations with these ASOs. They're not some giant, inaccessible organization. They're actually, many of them that I've talked to pride themselves in their local connections. They all currently manage the Colorado Crisis services for the Office of Behavioral Health. And so they're used to that kind of grassroots community discussion. So have those critical conversations with them, talk about the why, talk about the philosophy of Family First with them and residential services and how it's being reformed to make sure that children and youth get the best care that they can possibly get and then return home to their communities. And also stay tuned to CDHS YouTube series. We're going to be having a number of series or conversations around QRTP specifically. I see that there are a lot of questions popping up, and I'll try to get to those in the chat, but just be aware that this is not the end of the discussion. This is a very brief overview. So thank you.
And then Ashley, if you wanted to follow up on the placement continuum.
Yeah, so knowing and hearing about kind of all of these different options, I know there's a lot of questions in the chat, so I think Andrew's going to look at that and see if he can answer some of those for you. You know, what I think jurisdictions are asking, what can I do now as we get prepared for this? And these are just a few ideas. I encourage you to talk about this in your team meetings that come next, but taking a look at your own jurisdiction's data. So, you know, how many youth do you have in different types of care? What is available in your area? Where are those gaps? I think Yumiko talked about this earlier with placement. The placement continuum, you're going to be having some of those same conversations at the local level, which will help the state identify, you know, some areas where they can help and fill in. So talking to the youth, I think we heard Crystal talk about the beginning, really talking to the youth and families in the community in your local area about what their needs are. I think the state's done a really good job of, you know, canvassing and surveying different departments and counties and getting an idea of what's out there. But getting that discussion happening at that local level will just help make that more robust and identify needs ahead of time. And you can do that by meeting with your youth and your families in each of your communities. Engaging your placement providers about the needs of the youth in the community. I think there were some questions in the chat about, you know, who's going to become QRTP or not. I would encourage you to talk to the facilities in your area about where they're at in that process and what their plans are, which I think will help you at the local area make plans for that as well. And then as you gather that information, you use that in these state-led conversations around expansion of the placement continuum so that you can make sure your local needs are heard at that state level and then therefore get the resources and some of the help there. So these are just a few of the ideas of what you can do next. There was the question about the bench card that is available. You can access that through the link at the end of this presentation in the Judicial link. There have been several trainings given about that court process around the bench card. If your area would like to do your own specific training, we're happy to do that as well. You can contact myself or Megan Kersley as well.
And now we'd like to hand off to Gretchen to talk about Family First and juvenile justice.
Yeah, hi. So we have just about less than 10 minutes. So I'm going to go a little bit quickly, but please know that that doesn't mean this isn't important. A few things. I think that, Colorado is unique. Not all states are situated like us, where we really intertwine juvenile justice and child welfare. And so we have struggled a little bit, quite honestly, about getting guidance from other states or our federal partners. And so we took it upon ourselves to really stop and think about Colorado and what we needed to do. So I've been in a number of different presentations where there have been questions. Does this apply to delinquency cases? And it does. So everything that we talked about earlier throughout this presentation, it's for both dependency, neglect, and delinquency cases. What we also know is right now, juvenile justice is going through a huge reform through Senate Bill 19108. So this is dramatically changing the system for all involved in juvenile justice. That's from pretrial to probation to diversion to what counties do. And so we recognize that and are trying to really capture a way to show that. So I'll talk a little bit in a minute about a tool we have that may help people really see all of the differences. Youth involved in the delinquency system are considered candidates. So Yumiko talked a lot about the candidacy definition, and I want to be careful. We use the term child a lot. That means child and youth here in Colorado. And so please don't look at that candidacy definition and say, hey, that's not for these youth. It really is. And really that candidacy piece, like Ashley talked about, really helping to prevent at-home placement for some of these youth. So when I first read Family First, because of a lot of the work we've been doing in Colorado around crossover youth and really trying to have a better process for when kids were going into child welfare from juvenile justice or from child welfare to juvenile justice and crossing over, we're all trying to improve the system. When I read Families First, I thought, wow, this is an amazing opportunity for us to maybe get involved earlier on. And I say that with a caveat. A number of jurisdictions already do this. They have great plans. Others, it's difficult. And so we want people to continue to have the conversations. But prevention services, as much as I'd love to prevent delinquency from happening, that's not exactly what the prevention services are for. Although we've seen, if a kid is starting to act out or have issues, perhaps through a truancy case, or even other things that are happening at school, perhaps there are services and supports that could prevent them from actually picking up a charge. And so want to think about that. The other big thing is this QRTP. As Andrew mentioned, youth involved in delinquency court cases will need to follow the QRTP process if they are going into non-family-like settings. And then lastly, and very importantly, and something that we're continuing to discuss, is that we have to affirm to the feds that we will not instill any policies that would further drive youth into the juvenile justice system. So that is part of the act. There's a different part of the act that we're also working on around government accounting office doing a study to kind of determine the numbers of kids that may have been pushed into the juvenile justice system. And I don't like the word push, but that's the best way I can say it. So some of that language around that requirement was implemented into Senate Bill 2162 last year. So if you have specific questions, but basically it's asking the court if they commit a youth to the Division of Youth Services to make an additional finding. So I wanted to make sure that courts were aware of that and thinking of that once we start Families First, that would be a requirement if a youth is committed. So quickly, what we have a juvenile justice flowchart. This is the chart that I was talking about. We worked really hard to try and show the intersections of Families First, juvenile justice reform, and the child welfare system. This is up on our website. I will put a link in the chat, hopefully before we end. If not, it's on the CO4 Kids part with the judicial and legal pieces. It's in draft, and there's a reason it's in draft. We know that there's a bill changing all of 19.2 numbers, so we couldn't exactly just say it's good to go, but a really great group got together to do this work. That is something I want to make sure and talk about. We do have a juvenile justice specific work group for Families First. We're doing a number of things to try and educate others, bring information together for the different partners. And so if anyone's interested in being a part of that group, feel free to reach out. We meet the second Thursday of the month. One of our main goals of that group is really to train other stakeholders. We recognize, even at this convening, we don't necessarily have our probation partners, some of our juvenile judges who do the delinquency docket, district attorneys, defense counsel, although I saw some names on here. We need to do a better job of really sharing this across the state. So we do have a juvenile justice specific bench card training. It is online. We encourage you to watch it and encourage you to share it with your juvenile justice partners. Next slide, John. So what to do? Just as mentioned a number of times before, we are here to help, but you really need to start having these conversations if you haven't already at your local jurisdiction, whether it's using your best practice court team, your juvenile service planning committees, collaborative management, if you have one in your jurisdiction, to start to discuss how all of these pieces, especially 108 and Families First and the changes with child welfare, how it's all going to work in your community. What we suggest is really looking at your crossover plan, discuss ways to identify youth who might be eligible for those prevention services, and discuss, again, what services are available in your jurisdiction. What is nice is a number of these services that are on the clearinghouse and are out there are ones used in the juvenile for youth involved in the juvenile justice system. The other thing is reviewing that QRTP process and discuss how to do this with delinquent youth in your jurisdiction. Obviously, as Andrew mentioned, it's a little different. We might have a kid in detention. We might have a kid at risk of going into detention. There are other people that will need to be contacted by the independent assessor. One thing I want to note in my last minute, and I'm sorry to talk so quickly, is there's been a lot of concern. There's a lot of assessments in the juvenile justice realm, and then what is this new independent assessment process? The reality is all those other assessments aren't level of care assessments, but those assessments are important to share with the independent assessor. So if a juvenile justice involved youth has had a detention screen, a mental health screen, a probation sort of assessment, all of that will be really useful to the independent assessor if we're looking at a higher level of out-of-home placement. With that, I think that's it with my slides. I'm going to hand it back to John quickly. I'm sorry that we had to go really quickly, but if you have questions, please be in touch.
And I will mention, just as we wrap up here, there are some additional resources. We have 2 pages now of links, and I tried to include all of the links that were directly connected during the presentation today. We thank you for your attention on this. Feel free to look at all of those. Megan has assured me that the PDF of this is going to be posted in the app attached to this session. And so you'll have access to all of the links there. And I would endorse subscribing to the Family First Digest. You have to make sure that you select on that specific option when you get there. It's on the second link listed here on this page. And that should keep you abreast of changes that are as they emerge and keep you up to speed with things. There's also a training request form if you determine that that's one of the things you'd like to take as a next step. And again, we just thank you for your time and attention today.
Thank you, Family First panel. From here, we're going to take a quick break. You will join your convening team for team time, which starts at 9:45 a.m. You may access these team time links through your agenda and the main convening website. We will come back together for the final time for the regional goal sharing presentations, which starts at 1 p.m. Those links can also be found in the convening app. Thanks, everyone.
As folks are heading out,